Well, this morning I'm going to talk to you about understanding the serum-free light chain assays, or we also call them, it's brand name Free Light. I work for the company that manufactures the assay. So how many people here know what the serum-free light chain assays are? There's quite a few of you. How many people have no idea what the serum-free light chain is? It's okay to raise your hand because I know there's some newly diagnosed people here or people that are new to myeloma. Well, I'm here to tell you about the assays, and if you have any questions after the presentation, we have a question and answer period, but I also have a booth behind the middle door there, or out in the hallway, and I'm happy to answer questions afterwards, and we have a lot of literature for you for more information. So, Barbara had mentioned this. With breast cancer, for instance, people kind of know what that is, and they've heard about somebody that's had it. But multiple myeloma, how many people when they were diagnosed with myeloma didn't have any idea what multiple myeloma was? A lot of people. Well, frankly, I had been working in cancer diagnostics for many years, and I barely knew what multiple myeloma was before I started working for the binding site 3 years ago. So you're not alone. And this slide illustrates that myeloma starts, well, where does it start? Well, myeloma actually starts in the bone. And your bones are filled with bone marrow, which is a soft blood-forming tissue that fills all of the bones. And the blood cells are produced. They're red blood cells, white blood cells, and platelets. And in multiple myeloma, the plasma cells are the ones that have become cancerous, and those are a type of white blood cell illustrated here in this photomicrograph or picture from a microscope. And as I said, multiple myeloma is a cancer of the plasma cells, and those plasma cells are found in the bone marrow. And Dr. Kyle actually illustrated that well right at the beginning of his talk as well. And we have these two photomicrographs here, this one on the left and this one on the right. Anybody, can you tell me what's the difference between those two photomicrographs? Just shout it out. Color.
All over.
Number of cells, yes, here there's many fewer cells than there are here. This is normal bone marrow, less than 5% plasma cells will be in here. And then in multiple myeloma, you have abnormal bone marrow with sheets of plasma cells, tons of plasma cells will be in here. And the plasma cells produce antibodies. Now the plasma cells produce antibodies, or they're also called immunoglobulins. So we use the term antibodies and immunoglobulins interchangeably, and it means the same thing. And the plasma cells produce immunoglobulins and free light chains. So here's the immunoglobulins produced by the plasma cells, and here's the free light chains. And there are tests that can be used, and some of you may be familiar with these tests. Serum protein electrophoresis, and there's lots of acronyms. SPE means serum protein electrophoresis. Immunofixation electrophoresis is IFE. That can measure these intact immunoglobulins. And also the free light chains are produced by the plasma cells, and that the assays that we make for are called free light. So this illustrates again, the immunoglobulins are composed of heavy chains and light chains. And this slide shows that there's two types of free light chains, kappa and lambda. And the free light chain test measures both types of the light chain. We actually make two different tests, one for one chain and one for the other. So it's, this illustrates, the slide illustrates the important laboratory tests used for multiple myeloma. This is serum protein electrophoresis, and these are its abbreviations. Immunofixation electrophoresis, also abbreviated IFE. And these are tests that are electrophoresis tests. They're on a gel, and you actually get a picture of what's happening. And then the serum-free light chain tests are different. They're run on an instrument, so you actually get a number out, and you see that number on your laboratory report. So here's the whole antibody or intact immunoglobulin is here, and the lambda and kappa light chains are here, and these are measured by the free light assay. And then here's some important points about the free light chain assay. The free light chains are normally found in the blood, and free light chains circulate in the blood in abnormally high levels in many patients with multiple myeloma. The levels of the light chain and the antibodies are associated with a number of malignant plasma cells in the patient with multiple myeloma. So if you have more plasma cells, you generally have more light chains. And in multiple myeloma, free light chains can damage the kidneys, resulting in myeloma kidney and loss of kidney function. So free light chains are very important to study, especially if you have kidney damage. So this shows normal ranges have been established for the serum free light chains. And there are two sets of units used, milligrams per liter, and here for kappa, the normal range is 3.3 to 19.4 milligrams per liter, and lambda, it's 5.7 to 26.3 milligrams per liter. And then the kappa to lambda ratio is 0.26 to 1.65. So if you have a laboratory report and you're getting free light, you should see these normal ranges on your laboratory report. Now, some laboratories report out in milligrams per deciliter, and all that happens here is different units, and the decimal point is just moved over one place to get these values, and the ratio remains the same. So this is an example of a person that that was getting their laboratory values tested, and they came into the laboratory in May, and they got their serum free light chain tested. And you can see the laboratory report here. They have the kappa free light chain. There's a flag saying, oh, this is high. It's 38.5 milligrams per deciliter. And the reason it's high is it's outside the normal range, 0.33 to 1.94. It's outside of the range. So this patient, this is their value. Then they went to a different lab in July because perhaps they were traveling or something. And you can see how this laboratory report is quite different, and they're both quite cryptic. But you can see here's the free kappa light chain, and here it's 303, and it's also flagged as high. And they're thinking, oh my goodness, I've had quite a big change here. But then if you look at the units, you see, oh, it's really 385 milligrams per liter if you're comparing the correct values here. So they haven't changed all that much. They've actually come down a little bit. So this is to illustrate why the units are important. And you want to work with your physician to make sure you're not missing anything on the units. You can also see that the normal range is changed here because they're using the different units. So that could give you a clue as well. This shows an illustrating what's happening if a patient is monitored with serum free light chain and serum protein electrophoresis. So here's the free light chain and IgG levels during treatment. And the green is the kappa free light chain measurement, and the blue is the intact immunoglobulin G that's being measured. The patient comes in and begins chemotherapy, and if you see if they were just being monitored by serum protein electrophoresis, not much changes in the first few days of their therapy. But if you're monitoring with the free light chains, sometimes you can see a rapid decrease in the level of the free light chain. So sometimes the free light chain really helps physicians when they're monitoring you to find out more quickly if the therapy is working. This is an illustration of monitoring with serum free light chain and immunofixation electrophoresis. The free light chain is in blue, and immunofixation here is in green. And one of the things that's important, immunofixation is a qualitative assay. It's either positive or negative. So here you can see that it's either negative, the green is either down or up. With free light, it's a quantitative assay. It measures the amount as it's going forward. And you can see when the patient comes in, they got a transplant, and then they were being monitored after their transplant. And their free light values were going up, but the immunofixation was negative. And then all of a sudden, the immunofixation is positive, and the free light is rising as well. So what this happens here is the free light chain values trended up 3 months before the immunofixation became positive. So this is just an example of how the free light chain test can help physicians see more of what's going on for certain particular patients. This illustrates monitoring of therapy with serum free light chains. This is the level of the lambda serum light chain, and this is a patient that came in. They came in initially and their free light value is very high, and then they got a stem cell transplant and it dropped down, but then they went up again, and then they got some more therapy, and then it dropped down. And so they have patients all the time ask me about my free light values going up and down. What does this mean? Well, this is an illustration of a patient getting several different types of therapy, and their free light can go up and down a little bit while they're on the therapy. And then if this therapy is stopped, it can go down and then start back up again. They get a different therapy, and it drops down. And the same thing, this is bortezomib at the end having a dramatic effect, dropping it down all the way. So this line right here is the normal range. These two lines are the normal range for the lambda. it's dropping them finally down into the normal range, whereas they never were before. And this is, you can't really see this, it's too hard, but I think it's from 2000, I can barely see it myself, 2000 to 2006, so it's a long period of time. So you as a patient, if you're tracking your free light values, might see these peaks and valleys. And if you're concerned about a lot of these, you can talk to your physician about what exactly this means, because they've seen many people go through the process and they can help you with that. One other thing I wanted to talk to you about is there's an assay out there called the Total Light Chain Assay, and it's not very useful, but sometimes it gets ordered by accident on patients. And there are a number of different types of immunoglobulins, and they all have light chains attached to them. And then, of course, there's the free light chains that I've been talking about for the entire presentation. Well, these are all, this assay measures all the light chains, both the ones that are on the immunoglobulins and the ones that are free. But this assay is not too valuable clinically. There's not much data in the literature to say how it should be used. So generally, physicians are usually ordering it by accident. And the way you can tell that you have it is your values will be much higher. You see these normal ranges are up in the thousands. So if you get your laboratory back and your values are extremely high, whereas they were lower before, and maybe because they ran the wrong assay. So you want to check with your laboratory and your physician on that. And if you see the free light chain values, remember these normal ranges here are the ones you want to see if they're running the free light chain assay on you. And we have some literature on this if you need more information, if this has happened to you. I just saw a patient in San Francisco who lives out here who it had happened, the wrong assay had been run. And I want to talk a little bit about laboratory variability. The absolute values of serum free light chains can vary from lab to lab, and there's a number of different reasons for this. Each lab has different analytical instruments in them, and we actually have to make different kits for each instrument, so there could be some small variability. And of course, each lab has normal day-to-day and within-run variation, but laboratories take a lot of time out to make sure that this variation is below what you'd measure clinically, and they spend a lot of time so that they know the difference, and they're controlling for that. So if you change laboratories, if possible, obtain some of the last sample you had and run it along with a new sample, or you can establish a new baseline for your serum-free light chain levels. But the bottom line is that change in your absolute free light concentrations should not really affect your clinical interpretation. And to summarize everything I've talked about, we started talking about multiple myeloma, the cancer of blood cells, of the plasma cells, and they're found in the bone marrow. And these plasma cells produce antibodies and free light chains. And these molecules are actually measured with laboratory tests to tell you how your cancer is doing. And these tests, including free light chain tests, are used to be measured, and they're used to help monitor your therapy. So I hope this has helped you understand a little bit how the free light test is used and also how it's used with other laboratory tests. And I think if anybody has questions, we can have them during the panel, and I can also help you at the table afterwards.